Policymakers Hub. Thank you all for being with us today. For those who joined us last week, thank you for coming back. And for those of you who are joining us for the first time, welcome. I'd like to begin with a bit of a housekeeping, speaking about some of oh yes, before we go there, I'm sorry, I'd like to also introduce you to all of my colleagues, the great people that I've been working with throughout the past weeks to create this event. We're the BI project team. So I'd like to invite you, these are all of my colleagues, Eric, Johanna, Christina, Arjuri, Farah. They're with us today. They're all playing different roles, and it's thanks to their efforts and their commitment that we've been able to be here with you all today. So thank you so much to all my colleagues for making this happen as well. Now a bit of a housekeeping. This webinar is being recorded. It will be shared with all those who have signed up at the end. If you have any questions or thoughts throughout the presentation, throughout the webinar, I invite you to use the chat function to place your questions and comments in the chat box. Someone will be monitoring them from our team. But we also ask you to please keep your remarks respectful and recognize that we're all coming to this discussion from different perspectives, different points of view, and we're all kind of on a different point in the learning process. And we hope that you feel free to share your thoughts. We really look forward to the engagement part of this webinar. Wonderful. So in terms of what you can expect and the structure, so next slide, please, Eric. Just to let you know that the structure of our conversation today will be beginning with an introduction of our panelists. We have 4 wonderful panelists here with us today. I'll introduce each individually, invite them to speak to us, give us some opening remarks for about 7 minutes each, and then I'll move on to the next panelists. After all 4 of our panelists have spoken, I'll open the discussion and invite the audience to share questions, ask questions, and that will lead us to have a conversation up until 1 o'clock. At the 1 o'clock mark, you as the participants, you have the option of either staying, because we're going to be continuing with about a 30-minute conversation cafe where we'll break out into smaller rooms and have smaller group discussions. But of course, if you can't make that, no problem. Feel free to leave whenever it's convenient for you or whatever you have to do, no problem. And at the end, we'll let you know about our next upcoming webinars in this series, because as mentioned, this is just one event out of a series of events. All right. So to begin with, I'd like to introduce you to our first panelist. Our first panelist is Senator Donna Dasko. Senator Dasko was appointed to the Senate by Prime Minister Justin Trudeau in June of 2018. Senator Dasko was formerly Senior Vice President of Environics Research Group Limited and built the firm from a small consultancy into one of Canada's leading research firms. During her career, she led major research studies for federal and provincial departments and agencies, private sector clients and NGOs in areas including the economy, budget priorities, tobacco control, health promotion, national unity, and many other issues. She was a leader in developing media-sponsored polling, including the Globe Environics poll and election and special feature polling for the CBC. Dr. Dasko is also a senior fellow at the University of Toronto's Monk School of Global Affairs and Public Policy, and taught in its master's program before her Senate appointment. She's also a member of Statistics Canada's Advisory Committee on Social Conditions. So Senator Dasko, thank you again for joining us today, and I invite you now to please share your opening thoughts and remarks.
Okay, thank you. I will do so, and greetings from beautiful downtown Ottawa, where the Senate is actually sitting today and is going to be undertaking a debate, emergency debate, I hope today on races, and we'll be discussing that over the next few days in the Senate. So that's very important. So again, thanks for inviting me, and I'm really happy to see that you have an active group that's working on the concept of basic income. I approached this topic today as with two different hats on. One hat is as an activist, and another is as a legislator, because senators do help to make the legislation. Every piece of legislation has to go through the Senate before it becomes law, and so I look at it from that respect as well. As an activist, I look at it in that respect because I'm part of a group of senators who is promoting the concept of basic income, and we're trying to get it going off the ground. We're trying to promote it and have it taken up by the government in some way. So the concept of basic income has been discussed for many decades. I've been around for many of those decades to listen to the conversation, and but there is a lot more discussion of basic income now, and many people feel that the time has come to actually take the lead to create this as a real life policy. This concept, of course, has many different names over the years. It's called things like universal basic income, minimum basic income, guaranteed basic income, and terms like that, but I'll kind of stick to the term basic income. There have been a couple of important pilot projects on basic income in Canadian history, shall we say. There was a well-known pilot project in Manitoba in the 1970s that provided basic income. It was in the community called Dauphin, which is north of Winnipeg, and that project went on for 4 years, and it provided approximately 60% of the poverty line income. And it was a pilot, and there was a lot of really good research coming out of that. And I still hear research. I was born and raised in Winnipeg, and I heard over the years lots of people who worked on that data file, and there's a lot of findings that came out of that. And then more recently, there was a basic income pilot in the province of Ontario, and that was providing approximately $17,000 a year for single recipients. And I believe it was focused on reaching a 75% of the poverty level. There have been also various other proposals to go forward with a basic income, but those never got off, none of them ever got off the ground as established policy. But there's more activity in this area now than I've ever seen in all of my decades as somebody who's followed public policy quite closely. So the interest is coming from a couple of places. It's coming from the CERB, the Canada Emergency Response Benefit that the Government of Canada has put in place to deal with the dislocation of during the COVID crisis. And many people, including myself, see this as kind of a forerunner of a basic income that would be provided to everyone. 8 million Canadians have been receiving the CERB. The reason there's such enthusiasm about this as the sort of the forerunner is that the CERB itself seemed to be very easy for the government to roll out to a lot of Canadians. It got it right out the door. There was not a lot of red tape, and there was not a lot of hassle in getting the benefit out. At the same time as the CERB was rolled out, it also exposed that there were various gaps in the CERB, and there were people who were not served by it, and so the government had to fill the gaps. For example, with the student benefit that went to students, and so it exposed those gaps. It also exposed the gaps that exist in the employment insurance program. So taking these experiences from this, a basic income is often seen as the way to solve these issues. And it's a kind of slipstream, the basic income kind of in behind the CERB. The motivations for a basic income are two, essentially. One is social equity, and that is quite clearly helping Canadians in need and helping vulnerable Canadians to have a decent income and to have a stable income. And that's a very important goal. But there's also the goal of efficiency, whereby a lot of red tape would be seen to be, is that 5 minutes or?
It's just about 1.5 minutes left.
1.5 minutes left, okay. So the idea is that we would take the lessons and go with this. So I'll just really summarize briefly. So I'm part of a group of senators who's trying to promote this, and so I'll tell you a number of things that we do. There are about 50 of us who are in a working group who are trying to promote the basic income idea. We've connected with activists in the area. We've sent letters to the Prime Minister, Deputy Prime Minister, Finance Minister, and several other cabinet ministers. We are active on social media. The group is led by Senators Pate and Lankin. We meet weekly. We're active on social media. We write op-eds. We talk to other people about this. We promote it in the speeches we give in the Senate. We ask questions about the concept in question period. And so these are the ways that we feel that we want, or we think, hope to be effective in moving the concept forward. We as a group are not promoting a specific version of basic income. What we're trying to do is to get the idea off the ground. Now, I might just stop there. If I had more time, I would put my legislative hat on and then talk about the policy issues that would have to be addressed if it went ahead. So that's like getting into the weeds a little bit, but maybe I'll stop there right at that point and say that I'm really thrilled that you're working on this and promoting it, because there is a lot of work to do. You know, every time we, hear the finance minister speak, he's not that keen, he's not that keen on it. Others are, but anyway, we've got a lot of work done. There is a lot of work left to do. So I think my time is up, and I look forward to the other comments. Thank you.
Thank you so much, Senator Dasko. And as you mentioned, the sentiment of getting it off the ground is something that we share. And you have so much valuable knowledge to continue to share with us. And I invite those who are interested in hearing more, of course, to please pose the questions, and we'll continue this line of thinking in the Q&A. But next, I'd like to invite our next speaker, who is Dr. Gary Bloch. Dr. Gary Bloch is a family physician with St. Michael's Hospital and the Inner City Health Associates. He is also an associate professor at the University of Toronto. His internationally recognized clinical, research, advocacy, and innovation work focuses on the role of health providers in addressing social risks to health. He is also a senior fellow with the Wellesley Institute and AMS Phoenix Fellow. So thank you, Dr. Gary Bloch, for being with us, and I invite you now to please share your opening remarks. Thank you.
Sure, thank you so much. Please let me know if my audio cuts out and I'll reconnect by phone, but I'm hoping it works here from my basement. So yeah, it's really great that you are carrying forward with this exploration. I'm really happy to have Senator Dasko here, and have certainly worked in the past with the great Senator Hugh Segal, and I know there's just been a constant stream of work done through the federal Senate around basic income, which has been very powerful in keeping this issue alive. So, I primarily work as a frontline family doctor. I mean, that's really where I spend most of my days. Passion and my kind of academic focus, and in many ways, my clinical focus has really honed in on the link between income and health, between poverty and health, and between just sort of general social environments and other the social conditions that impact health, which I guess is kind of what brings me here today. Just in the last couple of weeks, I saw a patient of mine. He's a middle-aged man of Indigenous background. He's been on social assistance for a very long time, actually Ontario Disability Support. He has fairly significant physical disabilities and spends his time in a wheelchair. And he came to me repeatedly during the COVID pandemic, mainly because he was suffering extreme pain because of dental infections, for which he had no ability to actually access care, right? He couldn't, there's only one place in Toronto to get emergency dental surgery of the kind that he needed, and he had absolutely no private funding for private dental care. And it took him 2 months of living through extreme pain, repeated infections before he actually accessed the surgery, which was just a couple of weeks ago. Since then, you know, be able to find and afford food that he can eat without teeth, because all of his teeth were actually pulled out, let alone other medications and other supports during this time, not to mention he has very poor social supports and anyone else around to help him manage through this type of crisis. And it raised again for me the sort of centrality of income as an issue for my patients, for the people I see, but really for the millions of people who live with inadequate income in Canada. And really raised again why it is that I focus on this work. So, you know, I could spend hours talking about this. I will say simply that there is a huge body of evidence linking income with health outcomes. It all points in one direction, that if you don't have enough income, enough money in your life, your health is poor, and in many cases a lot poorer. And that is true for chronic illnesses, acute illnesses, accidents and trauma, especially true for children, really across the lifespan. Doesn't matter where you live. It is especially for racialized seniors, people who are Indigenous, etc. Right? And again, all areas that we could spend entire webinars talking about. And I think that last piece actually really does point to the fact that income is always interwoven with broader social conditions, broader social pressures on people's lives, whether those are things like people's ability to access employment or decent education, or big underlying structural forces like racism, history of colonialism, etc. So I have sort of tackled this from a number of levels. So I do a lot of work on the front lines as a clinician, trying to help people access income, and I'm very aware of the ins and outs and difficulties in accessing income through support systems as they stand. Although there are a lot of support systems out there, they are A, certainly inadequate, and B, very difficult to access for many people, especially people who face multiple challenges through disability or through other social pressures. I did participate as an expert panelist in something called the Income Security Reform Working Group a few years ago that actually did reform for the province of Ontario. And you know, we did develop a pathway to actually reforming the system as it stands to be able to better meet the needs of people who live at the social margins, and actually provide a more adequate level of income for people. Unfortunately, very little has happened down that pathway, really, I think for two reasons. The obvious one is just a change in government in Ontario, where the new government has less interest in carrying out this type of reform than the previous one. But also, I think because of, you know, what I would probably call kind of neoliberal incrementalism, in the sense that for decades, we've been focused on making very small changes to our income support systems that, you know, make it look like something is being done, but very little is being done that actually addresses the real poverty and real challenges people face on the grounds. So I think the idea of a basic income is actually a very interesting one to look at. And I think there's a strong case from a health perspective for a basic income. I will say up front that we already have basic income systems in children and for seniors. So we are not starting from nothing. We have decided to move forward with basic income for certain parts of our population already, but we're talking about everyone else, as well as bolstering the systems that exist. In terms of health evidence, again, to be brief about it, I'll point to the fact that the MINCOM study that Senator Dasko pointed to showed things like a lower rate of hospitalizations for those who receive basic incomes, less workplace injuries, lower ER visits, mental health related visits. And then the Ontario Basic Income pilot showed things like an 80% rate of self-reported health improvement, less pain, improved mental health, less tobacco and alcohol use, higher physical activity, self-confidence. I mean, really important markers of health improvements for participants in that study. And there are also other suggestions. Yeah, I will take 30 more seconds, and then we can come around to the rest in the question period. And there's been a lot of other health work done from an evidence-based perspective on the impacts of basic income, and a lot of it's positive. Not all of it shows dramatic change, and we can kind of come. So I think there's a very interesting piece to look at here. I will say that I'm not absolutely sold on any basic income being the way forward. And I appreciate Senator Dasko saying that, you are advocating for a basic income to be put on the table, not yet talking about the structure of that. Again, worth discussing in the discussion. My biggest concern, and this comes from my work as a family doctor, really comes around the ability of a broad basic income system to address individual needs, right? So when I spend my life sort of immersed in individual stories, and I do worry about our ability as a society to address the complexities of people's stories, whether that's because of disability, whether it's because of, structural inequities, or many other pieces that play into people's stories. Our ability to address those complexities through a blanket system like basic income. And I think that's something we will have to grapple with as we move forward with this idea in detail. So I'll stop there and then look forward to the discussion. Thank you.
Thank you so much, Dr. Bloch. You mentioned so many important points, especially the centrality of income inequality and, of course, the lack of political will that sometimes exists with a change of government. And so many important points that I'm sure we'll follow up on during the question and answer. So thank you for that. Next, I'd like to invite our next panelist, who is Shiva Mazrouei. Shiva is a passionate researcher, facilitator, and coffee consumer. She is currently carrying out national research on women's access to gainful employment as a research officer at YWCA Canada, and she focuses on the barriers faced by vulnerable women. Shiva has also led various initiatives and events focused on women's experiences, diversity, equity, and inclusion in her work in the nonprofit and humanitarian sectors. Thank you so much for being with us, and I invite you to please share your thoughts at this time.
Thank you so much for inviting me and for having me. Can everyone hear me? Are we good volume-wise? Perfect. Just a heads up, I tend to speak really quickly when I get excited about something. So Safa, if I'm going too fast, just put your hand up and I'll try to slow it down. Thank you again for inviting me and for having me. And I kind of want to just start off by positioning myself as an individual and how I'm approaching this topic today. So as mentioned, my name is Shiva. I was actually born in Iran, and my family and I immigrated to what is currently called Canada about 2 decades ago. And I grew up in Toronto, and I did have the chance to pursue higher education. And I've worked, as mentioned, in the humanitarian and nonprofit sector. So that's kind of the lens that I bring into any work that I approach. As well as mentioned in my professional realm, currently I'm carrying out national research with YWCA Canada, looking at the barriers and promising practices for increasing made vulnerable women's access to the labor market and to what we define as gainful employment. So a lot of my thoughts around basic income is also informed by hearing these experiences and the compounding barriers that women face to accessing employment. I don't claim to speak on their behalf, but my lens is definitely informed by the experiences that they've been kind enough to share with me. So when I started to think about basic income, and definitely income and low income is a barrier that we see to women's access to the labor market, I got super excited and I thought, yes, this is great. We're giving everybody income. And anytime I get super excited about anything, I have to reel myself back and start to ask some questions. And so that's what I thought I could kind of provide to this discussion today, as well as just some questions for us to start thinking about when we do have this discussion around basic income. And so the thing that some of the questions that I was thinking about is who will design the program of the basic income? As mentioned, the design is going to really matter. Who's centered in this design? Who will it apply to? So when we talk about the universality and we think universal, like mentioned with the CARB, we saw, okay, but what about students? What about people who are self-employed? Would a universal basic income include folks who are incarcerated? Would it include folks who are migrant workers? So really asking those questions of what are we talking about when we talk about universality of basic income. One of the main questions I ask about anything and any narrative that I hear is who benefits? So if we are to implement a basic income program, who are we targeting and who do we think will benefit? Will it be folks who are living at social margins? Will it be, if we're talking about the benefits that it will have for women, which is often the topic that I'm talking about, I like to ask which women are going to be included? Which ones are the ones who are going to benefit and truly reap the fruit of this, this policy? Another question that will come up is also the cost. I know there's going to be a lot of discussions around, will it cost too much? How much will it cost? And is that cost comparable to potentially and perhaps also at the same time increasing and making more accessible all of the social services that we need to have in place to support folks to really have the basics to survive and to thrive. So kind of I'm echoing a lot of what Dr. Bloch just kind of brought up, where I'm in the same sort of boat where I think basic income could be great, but I think we really need to also be talking about and advocating all of the services we need to have in place to support folks to actually have everything they need to survive. So when we talk about costs, we do have the financial costs to think about, and economists have done this work much better than I have in terms of what would the cost be and what would it be in comparison to making more accessible and more universal our social services. But my main question is, does it come at the cost of other social services? So are we proposing a basic income as a blanket solution and kind of saying, well, we've done it all and we don't really need to put in more into other policies, other services that people can access? So that's some of the questions that I started to ask myself. We have seen some of the arguments and some of the points for how a basic income would absolutely support women, particularly women living in precarious situations. And from my research as well, some of the main barriers we see that women face are accessing childcare, accessing housing, safe, secure, accessible housing, transportation, education. You have all of those compounding factors. So absolutely having access to a basic income will definitely help the bargaining power. It could help our starting point. But how much will that help if we also have increasing rent prices at the same time? If we still don't have an increase in the number of childcare positions that are available for women to access, or if transportation costs continue to raise. So those compounding factors for me are what we really need to be thinking about. And if we really do want to also advocate for having a really strong social network and really universal, accessible, affordable, safe social services, so access to housing, like I mentioned, transportation, childcare, education, food, all of those aspects we really need to think about. We also talk about a positive being for women who are living in situations of domestic violence, and absolutely access to finances and access to money is oftentimes a reason why women choose to stay in such relationships. But there's other factors, again, to consider, things like, will they actually have access to their own personal bank account? Is there financial literacy? They will still need to access safe and affordable housing, whether they have children, legal costs, mental health costs. And so all of these costs that will add up for services that might continue not to be affordable. So I really just I'm going to stop there. I have so much more. Again, this goes by really quickly. I do love the idea of basic income, but I really think we need to think bigger. And what I love about the SERB is that it really expanded our imagination and exposed us to what's possible. So I really want to encourage us all to imagine even beyond that and imagine what really we all need to have in place to survive and thrive. I'll stop there.
Thank you so much. Wonderful points, especially around who is designing this process, if it's going to happen, what voices are centered, and also in terms of the whole ecosystem of social services, how would this affect other services and how can they all work together? Thank you so much, and I'm sure we're going to continue speaking about those points in the Q&A. I'd like to now introduce everyone to our fourth panelist. Our fourth panelist is City Councillor Robert Kiley. So Councillor Kiley is a supply teacher by day and City Councillor by night in the city of Kingston. He is a well-known community leader and speaker. He is passionate about climate change, social justice, democratic reform, and good jobs. He is also chair of the National Basic Income Canada Youth Network and a board member of the Climate Caucus. So thank you so much for being with us, Councillor Robert. Maybe you can take the floor now and share your opening remarks.
Yeah, thanks so much. I'm very, very glad to be here. This is incredibly exciting for me to see young people coming together and mobilizing on basic income in a way that, frankly, I don't think I've seen in my about a decade dealing with this topic. So what I thought I'd do today is start with thanks. Thanks for all the participants for coming and filling up the chat here with amazing questions and really important points that I hope we can get to addressing, and to the other panelists and the organizers for making this a really rich discussion. So like I said, I want to reflect a bit on my 10 years in the basic income space and see how possibly that could answer some questions about how youth can get involved, and also the ways in which basic income is important to me as a city councillor and as a climate activist. So my work really started with basic income back in 2011. I was a 3-time provincial candidate for MPP in my hometown, which, as you know, is Kingston. And from that perspective, I really liked basic income because it promised to have really positive impact for people's health in our communities. We've heard Dr. Bloch talk about that very, very well. The social determinant of health of income being so integral for seeing people's mental and physical health go up. It also helps people achieve greater educational aspirations. So basic income is really good from a wellness perspective, and that's what I think government should be about. But also from a government perspective, basic income is streamlined. So we heard from Shiva, there are really important questions around, does basic income get introduced at the expense of other programs? Do other programs dovetail and then fade away if basic income comes in, is another way of asking that. Or do we keep other programs and basic income is just one of many ways in which we can support people in our communities? My preference is that we keep other programs, but we recognize that basic income will do the work of a lot of what those other programs are trying to do, but maybe not doing as well as they could. And by that, I mean, I don't want to see cuts to other programs just because basic income is implemented, which we hope it will be soon. So that was kind of my policy perspective as a candidate in a partisan sense. But when I left provincial politics in favor of City Hall and municipal politics, my perspective started to change a bit more, thinking about how does the program actually get delivered and what is the role of a municipal government in seeing that delivery happen? So in Ontario, 2 things I should say. One is there are no parties, which is really nice and really refreshing, and perhaps the senator will agree with me that working as an independent allows you to build constructive relationships across the ideological spectrum. So that's one thing. How can politicians of all stripes work together to see this happen at a local level? And the second is, in Ontario, municipal governments actually deliver some of the programs that the province funds. So what ways can mayors and councillors and even the bureaucracy, chief administrative officers and top-level city managers start to advocate to other levels of government to see this happen? And I think the potential is really there. And I draw on my experience in Kingston, though it was before my time as a councillor. Our council was the first municipality in Ontario to actually ask and promote a basic income. So there's definitely ways in which young people particularly can work with city councillors at a very kind of real grassroots level to see this promoted and amplified in very meaningful ways, I think. Another way that I want to talk about my activism that will, I hope, inspire some on the call today to get involved is the grassroots activism of the Basic Income Canada Youth Network. And that is a brand new group. We just started a few months ago, but it really builds on the work of the Basic Income Canada Network. They've been around for many years and are kind of the touch point, at least in my mind, of where you want to go to see good policy analysis on what basic income could look like. Not a particular basic income, which is a theme that's coming up here, but different options for a basic income and how that could be rolled out, because it is very feasible and it's even economical, which is a point I hope we can discuss a bit more in the question and answers, because often cost is something that's thrown up as the immediate reason why we shouldn't do this. But the Basic Income Canada Youth Network over the last few months has really punched above their weight, to use a boxing term. And essentially, we've done that by working with the senators group that was already mentioned. So particularly Senator McFedrin's Youth Council partnered with us to see a letter sent to many other ally organizations and individuals that represent over 1 million youth that signed on to this letter asking the Prime Minister to take the CERB, the Canada Emergency Response Benefit, and make it a permanent basic income, which is super exciting because, again, as mentioned, we've seen that the infrastructure in our bureaucracy is really there to quickly enact that type of financial support for those who need it. And I want to underscore the point about for those who need it. That's what the Basic Income Canada Youth Network is advocating for. So we're not talking specifically about what the delivery method may be, which is where I put on my city councillor hat and think about that, but we're talking about who actually should get this. We don't think it should be necessarily universal in that everyone in the country should get it, but it should be universal in the ability to access it. So if people are making under a certain income threshold, they should be able to receive it, all driven by the fact that we believe that income is a key social determinant of health, and that will help see people's wellness. So that's a bit about my work with Basic Income Canada Youth Network. And the final thing I wanted to end on is thinking about basic income in relationship to climate change. As a high school teacher, I see often that a lot of my students are really riddled with eco-anxiety. That's the term that I've been hearing lately, and you can see it palpably when they talk about climate change and the threat that they see it to be. It's an emergency, it's an existential threat to their futures. And many of them have started to really reconsider their priorities in life, some going as far as saying they're not going to have children in the future, or they might give up their dreams of what they want to be when they grow up to become full-time climate activists. And I really applaud that heart and that willingness to see the power that they have as youth and the way that they can change the world. But one of the things that has me worried as their teacher is how will they pay for their activism? How will they live a life trying to lobby government to change? Because it's very meaningful work, but it doesn't always pay much, if anything. The other thing, so I should fill that thought in, which is to say that a basic income would be there for people who are precariously employed, or even those who have regular employment, but it's under the gig economy. So they're kind of bumping around from contract to contract, which might mean they have some gaps in their employment. So basic income would be good for that, especially when it comes to these young climate activists. Another way that I think basic income dovetails with climate change is that it can help people reduce their CO2. So basic income could be a means of climate change mitigation. And we could see that by giving people more financial flexibility. It may allow them to make more climate-friendly purchases in the products that they can buy, and in the food that they can eat, and in the energy that they can consume. So the list really goes on, and that's especially important in Ontario, where any green energy subsidies have been rolled back, and people are essentially left to make that choice themselves, which many can't because they don't have the income needed for that. And then likewise, and I know my time is almost up, that with a bit more money, with some basic income, I think people might have the means to begin to adapt to climate change. So the science is incredibly clear. The weird weather that we've seen over the last few years is with us to stay, and it's only going to get worse. Extreme heat, extreme precipitation. So with a bit more money, people might be able to do basic infrastructure improvements to their own living conditions, like getting air conditioning, which is especially important for vulnerable populations, immunocompromised folks, older people, those who are underhoused. So a small thing like buying an air conditioner with a basic income could go a long way for keeping people well. And with that, I just want to end on a positive note, because there's a lot to talk about. And the positive note is this: over these 10 years of being in the basic income space, I've really seen it come to fruition of late. And there are a tremendous amount of young people really working to see this policy become a reality. It's important socially and economically, and I think environmentally too. And I hope that we have a bit more time to talk about that through Q&A and in the breakout sessions. So thanks for having me here.
Thank you so much, Councillor Robert. It was great to hear from you, especially to learn more about the Basic Income Canada Youth Network and also the perspectives of your students and also the link with climate change. Thank you all the panelists for sharing your thoughts. Now's the time that we are going to transition into the Q&A section. We have a lot of questions from our audience, and my colleague Christina will shortly share them, but I'd like to prioritize questions that are first directed towards Senator Dasko, because she does have to leave at 1 o'clock. So if there are some questions immediately for her, we can go through those first. And thank you again. So Christina, whenever you're ready, please do share the questions. Thank you, everyone.
Thank you, Safa, and thank you all the panelists for all those insightful perspectives. And it's a much needed conversation, especially now in the light of SARB and what we're seeing in terms of who's included and who's excluded from getting benefits. And there are a lot of questions that came into the chat, so I'm going to start with Senator Dasko. Actually, you have the first question. They would like to hear more about policy challenges and barriers, as well as the political will you see here within this group right now, like around BI.
Well, it's very interesting because we feel we're making progress, but at the same time, I see the question here about the finance minister. There is something about the I know this is a public setting, which is fine, and but this is not a private comment. This is a public comment. The Department of Finance has a certain way of thinking about things, about this issue, and they always seem to favor the more targeted approaches as opposed to a wider approach that would fall under a basic income kind of paradigm. And I'm not exactly sure why that is, but there is a preference for those approaches, and they don't seem to be very interested in, they've been asked this question, I've asked them this question, and their answer now is, we are focusing on the supports that are now in place for COVID, and we're not going to another space right now. So that's the kind of answer we get. So now, as far as policy development goes, I think the other panelists have certainly touched on many of the issues that are important. You may know of economist whose name is Armin Yalnizyan, and she has some very interesting points of view, just to speak to Shiva's points. So, I guess you kind of start with the idea that the money's not endless. Like, you can't absolutely have absolutely everything we want. Great childcare, housing, all the social services, basic income. So you start with the idea that you have to make choices. So she feels that the better choices would be to beef up social services, childcare, as Shiva was saying, better education, better healthcare in terms of the services that are not currently covered publicly, in terms of medications and other services like that. and she feels, and better jobs, supports for better jobs. So she feels that that's where you have to start. That's where you have to focus your spending. Other people, I think Mr. Kiley was talking about that you can do sort of both. I think that's what I take from your comments, is that you don't have to give up one for the other. But then, we still have questions in terms of policy questions with respect to basic income. And those questions would be, well, how much is it going to be? Who is going to get it? Dr. Bloch did mention that we do have supports in place now for seniors. All seniors are covered. We have supports for youth already involved in our social support system. And we have employment insurance, which is a program that is not a basic income program. It is an income replacement program. So we have many programs in place now. Well, what happens to those programs if we have basic income? And then with basic income, well, what are the rules? Are there rules around assets? People with assets, do they get this? Or people with income, do they get it? Is it taxed back? All of the issues around levels of income that you can earn. So I know this is really getting into the weeds, but these are the policy issues which would have to be dealt with. We have a huge infrastructure of programs already and services. We know that. Nobody wants those to go down. That's the fear. If we introduce this program, those programs will lose because of this dynamic, this push-pull. So nobody wants those to go down. In fact, many want those to get better, even if we have a basic income program. So these are some of the policy issues that face us as we go forward. I'm sure they can be solved, but this does take us into the territory of how we make the policy. How much will people get? Who is going to get it? And who is going to pay? The parliamentary budget officer did put the cost of basic income program at $44 billion. It's a lot of money. That was his calculation. And so we have to think about that as well. So anyway, I just put those out there, adding to the conversation that we've heard so far.
Thank you, Senator, for that response. And just a question that kind of ties into that, which, maybe yourself or Robert could take this, is why is Morneau against basic income?
Well, I think it's more related to the Department of Finance, the people who who run the department. They're very influential, and I think he listens to them. Those are the people who work for him, but I think he listens to them. And as I said earlier, for whatever reasons, they tend to focus on the targeted programs, and they like those more. And they are responsible for massive amounts of spending and supports that go to the provinces under various programs like the CHST and others. And so they've got their picture. The world is just this massive and interconnected world of programs and supports, and they kind of like to, more like tinker around the edges, and that's their way of dealing with it. And so that's the way I see it. And I'm not exactly sure. So that I think he listens to them, and that's where he gets his ideas from.
If I could just jump in for a moment, I would want to encourage a resource for the senator or for anyone that's interested in some of these nitty-gritty details. Basic Income Canada Network did a paper with a really well-known finance professor named Robin Bodway about 4 months ago, called Basic Income Policy Options. It's available on their website, and it gives 3 different scenarios in which a basic income could be rolled out, considering all the network of other policies that we've just heard about. Yeah. So if you want to dive into the details, there's some analysis done there.
That's a good idea. There's a lot of material. There's actually, you know, has been mentioned, there's so much, this conversation about basic income has become so rich over the last few months. I mean, you know, there's so much to read and to understand, and it's that's why this environment just seems to be very good for promoting it. That's why we're all working in this space, you know, trying to get the message out and trying to sort of get our heads around the various options and how we can promote this and what's the best way to go forward. So there's a lot of wonderful material out there, really.
Thank you for your responses and thank you for sharing the article. Yeah, we'll add it to the chat later. Another question that came in is how is the government collaborating with local advocacy organizations to help get basic income off the ground? I think maybe Shiva might be able to take this, or even Dr. Gary, if you want to as well.
I'll let Dr. Bloch take this one.
Sorry, you know what? You cut out a tiny bit there, Christina, during that question, so I missed the first half of it.
Oh, sorry. How is the government collaborating with local advocacy organizations to help get basic income off the ground?
It's an interesting question. I mean, it presumes there is collaboration, which I'm not sure how much collaboration there is specifically focused on the idea of basic income. You know, I think in the development of programs like the CERB, there has been some obvious work done between government and communication between government and frontline organizations, which I think has been positive, and especially kind of in this time focused on the needs of people who we are most worried about in the COVID crisis. I mean, I've done a lot of work, for instance, with people who experience homelessness during COVID, and I think there's been some very interesting relationships forged there with government. And, you know, this maybe speaks to the power of a crisis, which I think is an important piece to kind of bring forward when we think about advocacy around this. The power to develop or put a fire under conversations that many people wanted to have for a long time, but which sort of rise intensely in importance in the context of a pandemic and a crisis like we're facing right now. So, I mean, I've worked, for instance, with people experiencing homelessness for close to 20 years. I've never seen the level of cooperation between different sectors, including every level of government, the health sector, community sector, amongst others, that I've seen emerge in the last 3 months, right? And I think that is really important to recognize. I think our challenge as advocates, as people who want to bring forward new policy options, is thinking about how we continue these threads of conversation, these threads of cooperation forward beyond the kind of acute crisis moment. And I think there's real potential there. I think real relationships have been developed and formed. I think real inequities have been highlighted through this time of crisis. I think respect has developed and players have started to kind of recognize each other and recognize the sort of strength of experience, whether it's from a policy perspective, a lived experience perspective, you know, a government and having joint tables around this. So yeah, and I think everyone, like many people have been brought into these conversations who may not have been brought in otherwise. And I think this is really important. Where we're in a sort of youth-focused forum here, where often youth feel fairly disempowered in terms of, you know, your voice being heard. And again, this is a time when voices are being heard in ways that I have not seen in previous times. So I think here's a chance to really get things forward. People are very focused on the idea of inclusive tables in a way that I think is quite unique, at least in my time involved in this work. So hopefully that in some way answers that question, but there's my kind of thoughts there.
Thank you so much, Dr. Bloch. Before we go further, I realize it's 1 o'clock and Senator Dasko has to leave us. So before that happens, we'd like to just take a screenshot if everyone is okay with that. If not, you can turn off your camera, but we just want to take a screenshot before she leaves. So I'll just pass it to my colleague Eric, who's just gonna take a brief, quickly 1 second screenshot. So here we go.
All right, everyone. Looks like we have 2 screens worth of Zoom camera, so I'll take 2. We'll go for the first one now. So put a nice big smile. Thank you everyone for coming. 3, 2, 1. See if that one work. I'll double check. Yes, and then we'll do a second one. Make sure we get everyone included. 3, 2, 1. Let's see if this one worked. Yes, we are in business. Thank you everyone so much again, and particularly Senator Don Dasko for staying here till the very last minute. I'll pass off to Sarah or Safa for some final words.
Thanks, everybody. I hope it goes well. I really appreciate being invited, and you know, I hope that we're able to kind of keep this moving forward and eventually get the folks who you know, the policymakers to get their heads around this and forward. So thank you very much. Have a great day.
Thank you. Thank you so much.
Thanks. Bye. Thanks for inviting me.
Wonderful. So I noticed that it's 1:02, but before we go into breakout rooms, maybe we have time just for one final group question so everyone can hear the responses. So Christina, maybe there's one more we can share as a whole group.
Oh, there's so many to choose from. Oh man. I think this is a question that comes to everybody's mind when they talk about basic income. Someone brought up a question around, you know, the welfare system in the US and how sometimes people end up kind of in the cycle of poverty because of, you know, getting basic income and somehow don't have a strong work ethic and, you know, don't actually get work after that. I think that's a question on a lot of people's minds. So if anybody wants to take a shot at that, any of the panelists left, yeah, that would be great. Anyone can respond, the panelists.
So, my name is Catherine, and thank you for inviting me today. I've got a lot of friends that are artists and musicians, and they have not been able to get any kind of funding because they don't have a regular income and T4 coming in. So they haven't been able to apply for any kind of funding, and I've gone out of my way to try to help them financially. What I found in the past with many people is when they are given money, that money goes to whatever they want. They might not choose to get something better for their children or to help pay for their children's education or extra clothing. It might go to, I'm going to take my wife out for dinner tonight instead because I have that money. It's not going to go to something as wonderful as an air conditioner or something that's going to improve the life of their entire family. Often you have no way of deciding how that money will be spent, and you can't even suggest it because once somebody's money, you can't tell them how they can spend it or not. So we've, in our past, with fundraising for people and friends we know and have made over the years, we don't expect that. We just, if we want to help that person based on their ability and based on their personalities, then we help them out, whether it's trying to get them contacts down in New Jersey or through radio contacts for musicians and getting their works out on the radio broadcasting. That's our way of helping others out. But I found that if you hand out people money, you can't expect that it's going to in any way make a positive impact on their family. They will choose to do with it, especially if it's a husband and wife situation. Often the wife wants to do something good and the husband is the dominant one and says like, hell, I'm buying myself something. I'm getting what I've always wanted. And there's no way of changing that. So we do need the other social programs there as well. Thank you.
I can start off and then hand it off to Councillor Kiley, if that sounds good. So thank you so much for that question. And that's definitely a concern that has been raised in discussions of basic income. I personally tend to operate from the lens that we can trust individuals to be the experts in their own experiences and in their own needs. So when we are talking about basic income or any sort of provision, I operate from the position that they are the experts in knowing their situation and their circumstances. But going back to your point, of course, I agree that having strong social services in place is critical and crucial because oftentimes having just access to increased income still means that you have to decide between one service or the other. You still might have to decide, do you pay rent for safe, affordable housing, or do you pay for mental health care, or do you pay for transportation, or do you pay for childcare? And this is something that I saw in my research working with some of the women who on employment insurance, a lot of the times when they are given a certain reimbursement for lack of employment at a time, they are also provided with provisions for transportation, access to lower rent, and other supports. But the minute they start working, the minute they start having some aspect of income, some of those supports are taken away. And so a lot of the times the woman spoke to this time in between where you have a lot of those supports you were relying on taken away. You don't have access to free childcare anymore, but you're not at a level or at an income level enough to be able to support yourself and to thrive. And that's where they found themselves often being stuck in this kind of cyclical cycle of poverty, basically. So in that sense, absolutely, I think we should have stronger supports in place. And I think we can have that and basic income, in which case I think we're really supporting people to be able to choose for themselves how to best thrive. Councillor, I cut you off.
Not at all. That was very well said, and I'm glad you did. I just wanted to comment very briefly. I believe Senator Dasko made the comment when she referenced Dauphin, Manitoba, or perhaps it was Dr. Bloch, but the way in which research has suggested that when you give people a base amount of income, they actually start to break those cycles. We see the increase of educational attainment. I mentioned in my comments, physical and mental health, I think I also mentioned. So there is a way in which income, though we can't reduce everything to it alone and think that it will be the silver bullet to solve all these problems, is a way to elevate people beyond certain circumstances. And I think that's very important to acknowledge. I also wanted to very briefly mention an answer to a previous question around where can people get involved and how can they plug in and influence this right now, because both coasts, West Coast, well, there are 3 coasts in Canada, but the West Coast and East Coast in Canada right now are very exciting places for basic income. There's an expert panel right now reviewing it in British Columbia. So if anyone's on the West Coast or feels inclined to write into that, they have the opportunity to do so. So I would encourage that. Simple Google search can give you those coordinates. And then on the East Coast, all parties in the Prince Edward Island legislature, so that's the minority PC government backed by the official opposition Greens, and then a few Liberals, all 3 parties in the legislature are in support of the basic income and have now had 2 unanimous motions pass saying that. So there's appetite on the East Coast to see basic income happen as well. So if you're looking either direction, do that. And of course, then in Central Canada, the senators that have been mentioned are always looking for more expertise and more lived experience for people who have benefited from basic income, perhaps the Ontario Pilot Project recipients. So there is really a political moment happening right now, and I'd encourage everyone to look for ways in which they can influence that.
So, and I did just briefly want to address Catherine's other really important point, which is around people who tend to fall through the cracks of income support systems. And the example you gave was artists, which I think is or musicians. I think there are other groups that many other groups actually, that tend to fall through the cracks. People who haven't worked in the previous year, youth often fall through those cracks. And this is the idea of a basic income, depending on how it's implemented, certainly could help to block those holes in the social safety net. And I think that is very, very important to consider in thinking about how these programs could potentially be structured. And I will also agree that in my experience and also from the research, people tend to make good choices with extra money they're given, especially when they're living at low income. I am not concerned about individual choice as being something that should be seen as a barrier to this, or that the government should feel that they need to step in and control people's choices. We don't do that with people who are better off. I don't think we need to do that with people who live in poverty. And again, I think the research does support that.
Thank you everyone for your contributions. I realize it's 1:10 now, so this is the point where we'll just go into small groups. There's so many questions remaining. Everybody wants to share. So in smaller groups, we'll have more time for everyone to kind of speak. So at this point, we're just going to take a moment, and my colleague Eric is going to put us into small groups. We'll go away for about 10 minutes. We'll have small conversations. At around 1:20 or so, we'll come back as a big group and wrap up. So that's the plan for the next 10 minutes. So thank you, everyone, and just bear with us as we put everyone into small groups. In the room, thank you so much. I had a great discussion with my group. I'm sure everyone also shared a lot of different ideas and thoughts. So thank you for your participation. You know, everyone's voices is really important for us, and I hope that you had a chance to speak up in your groups as well. So that wraps up our Conversation Cafe segment. I really want to thank everyone for their contributions. As mentioned in the beginning, this webinar is part of a series of events. So looking ahead, we do have in 2 weeks' time, not next week, but in 2 weeks' time, another webinar with 4 other panelists planned. So if you could just go to the next slide, Eric, so we can just show them that. Wonderful. So this is a preview of some of the speakers who are going to be joining us next time. We have also 1 other mystery panelist to be determined who will also be joining us. So I encourage all of you to continue having these conversations with your friends, your colleagues, your families, and also come back in 2 weeks' time and share your ideas with us again in our next event. After our second panel series, we'll also have a design thinking workshop. So these are the upcoming events. If you haven't already signed up, you can do so. And thank you so much. We look forward to continuing the conversation. We encourage you all to stay connected. You can follow us as OCIC on our social media platforms, and keep tweeting about this issue, thinking about it, having the conversations. This kind of dialogue is really what pushes things forward. So thank you for the participation of everyone, and we look forward to seeing you all here next time. So thank you so much.
Thank you, everyone. Take care.